Generative AI has the potential to trim the fat from traditional healthcare scene in India. High costs, poor patient experiences, inefficiency in healthcare delivery, and drug development are all being addressed through generative AI. AI has been used in hospitals by medical practitioners and for general public healthcare purposes for many years. Even outbreak of COVID-19 was first identified by a Canadian AI startup called Blue Dog.
Generative AI has the capacity to generate, analyze, and interpret complex data, significantly contributes to advancing healthcare, making processes more efficient, accurate, and personalized.
Generative AI is a new subset of artificial intelligence, including algorithms that look for patterns and structures in the sample dataset and then try to create something similar.
It's creative from our human perspective because they create something new. But all they do it with patterns and structures in a huge amount of data. To be able to create new, that's why it's called generative. It creates new things.
We have seen this in the form of ChatGPT, Bard AI, or in the form of Dolly. Through generative AI, can we fix healthcare issues in India, which has largest population in the world?
India has very poor healthcare access and quality index. Even it is behind Bangladesh and Sri Lanka. The maternal mortality rate in India is almost 5 times higher than that of China. With one qualified doctor per 1000 population, India also faces a shortage of physicians. Healthcare expenditures push so many people into poverty every year. India's low public expenditure on healthcare is just over 2%. Other healthcare barriers include the lack of active disease management and low priority to preventive care. Comparatively low attention to R&D and cutting-edge technology-led new projects also restrict the healthcare sector's progress.
How will generative AI heal Indian healthcare challenges? Here I am providing you some of my thoughts. Number one is patient care. Generative AI can be harnessed to create personalized treatment plans for patients.
The algorithm can examine a patient's medical background, genetic information, lifestyle choices, and other factors to develop a tailored plan. For instance, the algorithm can examine a patient's tumor DNA and pinpoint the genetic mutations causing the cancer.
Number two is personalized medical chatbots. Healthcare organizations can develop medical chatbots that provide patients personalized medical advice and recommendations. Number three is diagnosis of diseases. Generative AI can revolutionize disease diagnosis by leveraging large data sets of medical images to identify patterns associated with specific conditions.
Similarly, generative AI can also speed up the diagnosis of diseases by studying medical images such as CT scans, X rays, and MRIs. The algorithm can recognize patterns linked to particular diseases by learning from a sizable dataset of medical images. Generative AI is now emerging as a game changer that can transform the patient care pathway. It can play a significant role through precision diagnosis in advanced care for a range of non communicable diseases, that is, NCDs, responsible for 66% of all deaths in India, out of which 82% are due to cardiovascular diseases, chronic respiratory diseases, cancer, and diabetes. Ironically, more premature NCD deaths are preventable, and generative AI can bring down the casualty rate by enabling the detection of risk factors and helping health professionals respond faster to prevent diseases. Sometimes the content generated can be challenging to interpret. The difficulties in understanding the algorithm's decision making process will impact trust and decision making. Acquiring large data sets for training may be challenging, limiting effectiveness in certain healthcare areas. Ensuring transparency is crucial to addressing biases, fostering trust among providers and patients.